Encouraging empathy and compassion. Empathy and compassion are powerful antidotes to stigma, allowing us to connect with others on a deeper level and validate their experiences. By practicing empathy and compassion towards individuals with NPD, we can create a culture of acceptance and support that empowers them to seek help, engage in treatment, and cultivate meaningful relationships. Through small acts of kindness, active listening, and non-judgmental support, we can break down barriers and create a more inclusive and compassionate society for all. Breaking the stigma of narcissistic personality disorder requires a concerted effort to challenge misconceptions, promote understanding, and cultivate empathy and compassion for those affected by the disorder. By acknowledging the human experience behind NPD, promoting accessible and stigma-free care, educating the public, and encouraging empathy and compassion, we can create a more supportive and inclusive society where individuals with NPD feel validated, understood, and empowered to seek help and thrive. As we conclude our exploration of narcissistic personality disorder, we invite you to share your thoughts and experiences in the comments below. Have you encountered NPD in your personal or professional life? What strategies have you found effective in managing relationships with individuals who exhibit narcissistic traits? Join the conversation, and together, let's deepen our understanding of this intricate psychological phenomenon. Thank you for joining us on this enlightening journey. Stay tuned for more insights and discussions on psychology and the human mind, only on Psych IQ. Welcome to Psych IQ, where we delve into the intricate world of psychology to unravel the mysteries of the human mind. In this note, we embark on a journey to explore narcissistic personality disorder, NPD, a condition that affects individuals on multiple levels, from their relationships to their sense of self. Join us as we navigate through the defining traits, underlying causes, and potential treatments of this complex disorder. 1. Defining narcissistic personality disorder. Narcissistic personality disorder is a mental health illness in which people have an unreasonable air of superiority. They need and seek too much attention, and they want people to admire them. People with this disorder may have trouble understanding or not caring about the feelings of others. However, behind this mask of absolute self-confidence, they are unsure of themselves and react easily to the slightest criticism. Narcissistic personality disorder causes problems in many areas of life, such as interpersonal relationships, work, school, or financial matters. In general, people with narcissistic personality disorder may feel unhappy and disappointed when they are not given special favors or do not receive the admiration they believe they deserve. They may feel that their interpersonal relationships are conflictual and unsatisfying, and others may not enjoy their company. Treatment for narcissistic personality disorder focuses on talk therapy or psychotherapy. This disorder affects men more than women and usually begins in adolescence or early adulthood. Some children may manifest traits of narcissism, but this is usually age-typical, so it does not mean that they will have narcissistic personality disorder in the future. Narcissistic personality disorder is characterized by a pervasive pattern of grandiosity, a constant need for admiration, and a lack of empathy for others. Individuals with NPD often display an exaggerated sense of self-importance, an excessive craving for attention, and a tendency to exploit others for their own gain. Narcissistic personality disorder, NPD, stands as a distinctive psychological condition characterized by a pervasive pattern of grandiosity, a relentless craving for admiration, and a profound lack of empathy towards others. At the core of NPD lies an inflated sense of self-importance, where individuals with this disorder harbor an exaggerated belief in their superiority and entitlement. They often project an aura of superiority, considering themselves special or unique, deserving of special treatment and recognition. This grandiosity manifests in various aspects of their lives, from their relationships to their professional endeavors. Moreover, individuals with NPD are driven by an insatiable need for constant admiration and validation. They seek admiration and praise from others relentlessly, often resorting to self-aggrandizement and exaggeration of their achievements or talents to garner attention. This constant pursuit of admiration becomes a central driving force in their interactions, overshadowing genuine connections and empathy for others' experiences. One of the hallmark traits of NPD is a profound lack of empathy. Individuals with this disorder struggle to recognize or understand the emotions and needs of others, viewing them primarily as tools for their own gratification or validation. This lack of empathy can lead to exploitative behavior in relationships, where individuals with NPD may manipulate or disregard the feelings and boundaries of others to serve their own interests. In summary, narcissistic personality disorder is characterized by a complex interplay of grandiosity, a relentless pursuit of admiration, and a profound lack of empathy. Understanding these defining features is crucial in identifying and addressing the challenges faced by individuals with NPD, as well as navigating the complexities of relationships with them. 2. The spectrum of narcissism. Narcissism exists on a spectrum ranging from healthy levels of self-confidence to pathological narcissism seen in NPD. While some degree of narcissistic traits is common in the general population, it becomes problematic when it significantly impairs functioning and causes distress to the individual or those around them. Narcissism exists along a continuum ranging from healthy self-esteem and confidence to pathological narcissism observed in Narcissistic Personality Disorder, NPD. It's important to recognize that narcissistic traits are not inherently negative. In fact, a certain degree of narcissism can be beneficial, contributing to self-assurance, ambition, and resilience in the face of challenges. However, when these traits become exaggerated and maladaptive, they can lead to significant impairment in functioning and interpersonal relationships. At one end of the spectrum, individuals may exhibit healthy narcissistic traits, such as confidence, assertiveness, and a strong sense of self-worth. These individuals have a balanced view of themselves and others, able to maintain fulfilling relationships while pursuing their goals and aspirations. Healthy narcissism serves as a protective factor, enabling individuals to navigate life's challenges with resilience and optimism. Moving along the spectrum, moderate levels of narcissism may manifest in behaviors characterized by a desire for recognition and achievement. These individuals may display confidence and ambition, driven by a healthy sense of self-esteem and self-worth. While they may seek validation from others, it does not come at the expense of empathy or genuine connection with those around them. However, as narcissistic traits become more pronounced and pervasive, they can transition into pathological narcissism, culminating in narcissistic personality disorder. Individuals with NPD exhibit extreme levels of grandiosity, a relentless need for admiration, and a profound lack of empathy for others. Their sense of entitlement and superiority often leads to exploitative behavior in relationships, as they prioritize their own needs and desires above those of others. It's crucial to recognize that the spectrum of narcissism is not static. Individuals may fluctuate between different levels of narcissistic traits depending on various factors, such as life circumstances, stressors, and interpersonal dynamics. Additionally, the presence of narcissistic traits does not necessarily indicate the presence of NPD. A comprehensive assessment by a mental health professional is necessary to determine the severity and impact of narcissistic traits on an individual's functioning and well-being. Understanding the spectrum of narcissism allows us to appreciate the nuances of this complex phenomenon and tailor interventions and support accordingly. By promoting self-awareness and empathy, we can help individuals navigate the challenges associated with narcissistic traits and foster healthier relationships and personal growth. 3. The origins of narcissistic personality disorder. The development of NPD is influenced by a combination of genetic, environmental, and psychological factors. Childhood experiences such as excessive praise or criticism, neglect or abuse, can contribute to the formation of narcissistic traits. Additionally, genetic predispositions and neurobiological factors may play a role in the development of the disorder. It is not known what causes narcissistic personality disorder. It is possibly a complex cause. Narcissistic personality disorder may be associated with the environment, parent-child relationships that are characterized by too much adoration or too much criticism, and that do not correspond to the child's actual experiences and achievements. Genetic. Certain inherited characteristics, such as certain personality traits. Neurobiology, the connection between behavior, the brain, and thinking. Risk factors. Although the cause of narcissistic personality disorder is unknown, some researchers believe that parental overprotection or neglect during upbringing may influence children who are born with a tendency to develop this disorder. Genetics and other factors can intervene in the development of narcissistic personality disorder. Complications. Complications of narcissistic personality disorder and other conditions that may accompany this disorder include the following: relationship problems, problems at home and at school, depression and anxiety, other personality disorders, an eating disorder called anorexia, physical health problems, abuse of addictive substances or alcohol, suicidal thoughts or behaviors. Prevention. Since the cause of narcissistic personality disorder is unknown, we do not know how to prevent it. However, this may help. Seek treatment as soon as possible for childhood mental health problems. Do family therapy to learn healthy ways to communicate or cope with conflict or emotional suffering. Attend parenting classes and seek help from a therapist or social worker if necessary. The development of narcissistic personality disorder, NPD, is a multifaceted process influenced by a combination of genetic predispositions, environmental factors, and psychological dynamics. Understanding the origins of NPD requires a comprehensive exploration of the individual's upbringing, early experiences, and internal psychological processes. Genetic and neurobiological factors. Research suggests that genetic predispositions may play a role in the development of NPD. Studies have identified certain genetic markers and hereditary patterns associated with narcissistic traits, indicating a biological basis for the disorder. Additionally, neurobiological studies have revealed differences in brain structure and functioning among individuals with NPD, particularly in regions associated with self-regulation, empathy, and emotional processing. Early childhood experiences. The early childhood environment plays a critical role in shaping personality development, including the emergence of narcissistic traits. Individuals with NPD often have a history of adverse childhood experiences, such as neglect, emotional abuse, or inconsistent parenting. These experiences may lead to disruptions in attachment bonds, impairments in self-regulation, and the internalization of maladaptive coping mechanisms. Parental influence. The relationship between parents and their children has a profound impact on the development of narcissistic traits. Parents who excessively praise or indulge their children without setting appropriate boundaries may contribute to the formation of narcissistic tendencies. Conversely, parents who are overly critical or dismissive may instill feelings of inadequacy and fuel the individual's need for validation and approval from others. Cultural and societal influences. Cultural and societal factors also play a significant role in shaping the expression of narcissistic traits. In cultures that value individualism, material success, and self-promotion, narcissistic behaviors may be more prevalent and socially rewarded. Additionally, the rise of social media and celebrity culture has created platforms for individuals to seek validation and admiration on a global scale, further reinforcing narcissistic tendencies. Psychological mechanisms. On a psychological level, individuals with NPD often employ defense mechanisms such as denial, projection, and idealization to protect their fragile self-esteem and maintain their grandiose self-image. These defense mechanisms serve as coping strategies to shield the individual from feelings of inadequacy, vulnerability, and shame. In summary, the origins of narcissistic personality disorder are complex and multifaceted, involving a combination of genetic predispositions, early childhood experiences, parental influences, cultural factors, and psychological dynamics. By understanding these underlying factors, we can gain insight into the development of narcissistic traits and tailor interventions to address the root causes of the disorder. 4. Common traits and behaviors. The symptoms of narcissistic personality disorder and their severity can vary. People who have this disorder may, having an air of unreasonable superiority and constantly needing excessive admiration from others, feeling that they deserve privileges and special treatment, expecting your superiority to be recognized, even without having achieved anything, make your achievements and talents seem more important than they are preoccupying fantasies about success, power, brilliance, beauty, or the perfect partner, believing that they are better than others and that they can only spend time with people as special as them, or that only those types of people will be able to understand them, criticize and belittle people who do not consider important, expect special favors and for others to do what they want without question, taking advantage of others to get what they want, having an inability or unwillingness to recognize the needs and feelings of others, envying others and believing that they are envied by other people, behaving arrogantly, boasting a lot and being considered conceited, insist that they have the best of everything. For example, the best car or the best office. At the same time, people with narcissistic personality disorder have difficulty reacting to what they perceive as criticism. They can behave in the following way: becoming impatient or angry when they do not receive recognition or special treatment, have great difficulty interacting with other people and feel easily belittled, reacting with anger or disdain, and treating other people with contempt to give the impression that they are superior, have difficulty managing your emotions and behavior, have great difficulty facing stressful situations and adapting to changes, avoid situations in which they may fail, feeling depressed and moody because they don't achieve perfection, having hidden feelings of insecurity, shame, humiliation, and fear of being discovered to be a failure. Individuals with NPD often exhibit a range of characteristic traits and behaviors, including grandiosity and a sense of entitlement, preoccupation with fantasies of unlimited success, power, or beauty, belief in their own uniqueness and superiority, lack of empathy and disregard for the feelings and needs of others, exploitative behavior in relationships, fragile self-esteem and vulnerability to criticism. Narcissistic personality disorder, NPD, is characterized by a constellation of traits and behaviors that significantly impact the individual's relationships, functioning, and overall well-being. Understanding these common traits and behaviors is essential for recognizing and addressing the complexities of NPD. Grandiosity and exaggerated self-importance. Individuals with NPD often exhibit grandiose beliefs about their own abilities, accomplishments, and importance. They may exaggerate their achievements, talents, or status, presenting themselves as superior or exceptional compared to others. This inflated sense of self-importance serves as a protective mechanism to mask underlying feelings of insecurity and inadequacy, constant need for admiration. A hallmark feature of NPD is the relentless pursuit of admiration and validation from others. Individuals with this disorder crave attention, praise, and recognition, seeking reassurance of their worth and superiority. They may go to great lengths to garner admiration, resorting to self-promotion, manipulation, or exploiting others to fulfill their need for admiration. Lack of empathy and exploitative behavior. One of the most challenging aspects of NPD is the profound lack of empathy towards others. Individuals with this disorder struggle to recognize or understand the emotions and needs of others, viewing them primarily as instruments for their own gratification. They may exploit or manipulate others to serve their own interests, disregarding the feelings and boundaries of those around them. Sense of entitlement. Individuals with NPD often have an entitled attitude, believing that they are inherently deserving of special treatment, privileges, or attention. They may expect others to cater to their needs and desires without considering the needs of others or reciprocating in kind. This sense of entitlement can lead to conflicts in relationships and a disregard for social norms or rules. Fragile self-esteem and vulnerability to criticism. Despite their outward display of confidence and superiority, individuals with NPD often have fragile self-esteem that is easily wounded by criticism or rejection. They may react defensively or aggressively to perceived slights or challenges to their self-image, resorting to denial, blame-shifting, or retaliation to protect their fragile sense of self-worth. Interpersonal difficulties and relationship instability. Narcissistic traits often contribute to difficulties in forming and maintaining meaningful relationships. Individuals with NPD may struggle with intimacy, trust, and empathy, leading to a pattern of unstable relationships characterized by idealization, devaluation, and discard. Their manipulative and exploitative behavior can erode trust and create interpersonal conflict, further isolating them from genuine connections. In summary, the common traits and behaviors associated with narcissistic personality disorder reflect a complex interplay of grandiosity, entitlement, lack of empathy, and vulnerability to criticism. Recognizing these patterns is essential for early intervention and support, both for individuals affected by NPD and their loved ones, navigating the challenges of relationships with them. 5. Impact on relationships and functioning. 5. Impact on relationships and functioning. The presence of narcissistic personality disorder, NPD, exerts a profound impact on various aspects of an individual's life, particularly their relationships and overall functioning. Understanding the ramifications of NPD on relationships and functioning is essential for navigating the complexities of interpersonal dynamics and providing support to those affected by the disorder. Disrupted interpersonal relationships. Individuals with NPD often struggle to establish and maintain healthy, fulfilling relationships due to their narcissistic traits and behaviors. Their constant need for admiration, lack of empathy, and exploitative tendencies create an environment of emotional instability and manipulation, undermining trust and intimacy. Relationships with narcissistic individuals may oscillate between idealization and devaluation, as they alternate between showering others with praise and withdrawing affection or resorting to criticism. Difficulty in empathy and emotional connection. One of the most challenging aspects of NPD is the profound lack of empathy exhibited by individuals with the disorder. They struggle to recognize or understand the emotions and experiences of others, viewing them primarily as objects to fulfill their own needs and desires. This lack of empathy undermines the foundation of genuine emotional connection and mutual support in relationships, leading to feelings of loneliness, frustration, and isolation for both parties involved. Exploitative and manipulative behavior. Individuals with NPD may engage in exploitative and manipulative behavior to meet their own needs and desires, disregarding the feelings, boundaries, and well-being of others in the process. They may use tactics such as gaslighting, guilt-tripping, or emotional blackmail to control and manipulate those around them, perpetuating a cycle of dysfunction and power imbalance in relationships. Impact on personal and professional functioning. Narcissistic traits can also have a significant impact on an individual's personal and professional functioning. In personal life, individuals with NPD may struggle with maintaining stable employment, financial responsibility, and long-term goals due to their impulsive behavior, difficulty working in teams, and conflicts with authority figures. In professional settings, their grandiose beliefs and entitlement may lead to conflicts with colleagues, difficulties accepting feedback or criticism, and a lack of accountability for their actions. Psychological distress and co-occurring disorders. Living with NPD can also take a toll on the individual's mental health and overall well-being. The constant need for validation and admiration may contribute to feelings of inadequacy, anxiety, and depression when their expectations are not met. Additionally, individuals with NPD may be at an increased risk of developing co-occurring mental health disorders such as depression, anxiety, substance abuse, or other personality disorders. In summary, the impact of narcissistic personality disorder on relationships and functioning is far-reaching and multifaceted. By understanding the dynamics at play and implementing effective interventions and support strategies, we can mitigate the negative effects of NPD and foster healthier, more fulfilling relationships and lifestyles for individuals affected by the disorder and their loved ones. 6. Diagnosis and treatment options. People who have narcissistic personality disorder may not want to think that something is wrong with them, so they often do not seek treatment. If they seek treatment, they are more likely to do so to treat symptoms of depression, substance or alcohol abuse, or another mental health problem. It may be difficult to accept things that you consider insulting to your self-esteem and continue with treatment. If you recognize aspects of your personality that are common in narcissistic personality disorder, or if you feel overwhelmed by sadness, consider contacting a mental health professional or trusted healthcare provider. Getting the best treatment for you can help you live a fuller, more enjoyable life. Diagnosing NPD typically involves a comprehensive assessment by a mental health professional who evaluates the individual's symptoms, behaviors, and history. Treatment for NPD often involves psychotherapy such as cognitive behavioral therapy or psychodynamic therapy, aimed at addressing underlying issues, improving self-awareness, and developing healthier coping mechanisms. Medication may also be prescribed to manage co-occurring symptoms such as depression or anxiety. 6. Diagnosis and treatment options. Diagnosing and treating narcissistic personality disorder, NPD, requires a comprehensive and multidimensional approach that addresses the complex interplay of symptoms, underlying psychological factors, and individual needs. From accurate diagnosis to tailored interventions, understanding the diagnostic process and available treatment options is crucial for effectively managing NPD and promoting positive outcomes for individuals affected by the disorder. Diagnosis of narcissistic personality disorder. Diagnosing NPD typically involves a thorough assessment conducted by a qualified mental health professional, such as a psychiatrist, psychologist, or licensed therapist. The diagnostic process may include clinical interviews, psychological evaluations, and standardized assessments to evaluate the presence and severity of narcissistic traits and their impact on functioning and relationships. Diagnostic criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, serve as a guideline for identifying NPD, including features such as grandiosity, lack of empathy, and a pattern of exploitative behavior. Treatment modalities for narcissistic personality disorder. While NPD poses significant challenges, various treatment modalities offer hope for individuals seeking support and relief from their symptoms. Treatment for NPD typically involves psychotherapy, medication management, and supportive interventions aimed at addressing underlying issues and improving coping skills and interpersonal functioning. Psychotherapy. Cognitive behavioral therapy, CBT, CBT focuses on identifying and challenging maladaptive thought patterns and behaviors associated with NPD. By fostering self-awareness and developing healthier cognitive and behavioral strategies, individuals with NPD can learn to manage their symptoms more effectively and improve their interpersonal relationships. Psychodynamic therapy. Psychodynamic therapy explores the unconscious processes and early childhood experiences that contribute to the development of NPD. Through insight-oriented approaches and exploration of underlying conflicts and emotions, individuals can gain a deeper understanding of their narcissistic traits and work towards meaningful change and personal growth. A dialectical behavior therapy, DBT. DBT combines elements of cognitive behavioral therapy with mindfulness-based techniques to help individuals with NPD regulate their emotions, improve interpersonal skills, and develop effective coping strategies for managing distressing thoughts and behaviors. Medication management. While medication is not typically used as a primary treatment for NPD itself, it may be prescribed to manage co-occurring symptoms such as depression, anxiety, or impulsivity. Antidepressants, mood stabilizers, or antipsychotic medications may be recommended by a psychiatrist to address specific symptoms and improve overall functioning. Supportive interventions and self-help strategies. Supportive interventions such as group therapy, family therapy, or support groups can provide individuals with NPD with a safe and validating space to explore their experiences, share insights, and receive encouragement from others facing similar challenges. Self-help strategies, including mindfulness practices, stress management techniques, and healthy lifestyle changes, can complement formal treatment and promote overall well-being and resilience in individuals with NPD. Collaborative and holistic approach. Effective treatment of NPD often requires a collaborative and holistic approach that addresses the individual's unique needs, preferences, and goals. By working closely with a multidisciplinary team of mental health professionals, individuals with NPD can receive comprehensive care that integrates various treatment modalities and supports their journey towards recovery and personal growth. In summary, the diagnosis and treatment of narcissistic personality disorder encompass a range of therapeutic approaches aimed at addressing the complex symptoms and underlying psychological dynamics associated with the disorder. By offering compassionate and evidence-based care, we can empower individuals with NPD to cultivate self-awareness, develop healthier coping mechanisms, and build more fulfilling relationships and lives. 7. Breaking the stigma. It's essential to recognize that individuals with narcissistic personality disorder are not inherently bad people. Like any mental health condition, NPD is a complex interplay of various factors, and those affected deserve compassion and support on their journey towards healing and recovery. 7. Breaking the stigma. Breaking the stigma surrounding narcissistic personality disorder, NPD, is essential for fostering understanding, empathy, and effective support for individuals affected by the disorder. By challenging misconceptions and promoting awareness, we can create a more compassionate and inclusive society that recognizes the complexities of NPD and supports those navigating its challenges. Dispelling myths and misconceptions. One of the first steps in breaking the stigma of NPD is dispelling myths and misconceptions surrounding the disorder. Contrary to popular belief, individuals with NPD are not simply egotistical or self-absorbed. NPD is a complex psychological condition characterized by underlying vulnerabilities, maladaptive coping mechanisms, and profound difficulties in relating to others. By reframing the narrative around NPD, we can foster greater understanding and empathy for those affected by the disorder. Recognizing the human experience. Behind the diagnostic criteria and clinical terminology, individuals with NPD are human beings deserving of compassion, support, and understanding. Their behavior and symptoms are often rooted in deep-seated insecurities, past traumas, and unmet emotional needs. By acknowledging the human experience behind NPD, we can break down barriers and cultivate empathy for those struggling with the disorder, encouraging open dialogue and meaningful connections. Promoting accessible and stigma-free care. Access to stigma-free mental health care is crucial for individuals with NPD to seek support and treatment without fear of judgment or discrimination. Mental health professionals should strive to create safe and validating spaces where individuals with NPD can openly discuss their experiences, receive personalized care, and access evidence-based treatments tailored to their needs. By promoting accessible and stigma-free care, we can empower individuals with NPD to prioritize their mental health and well-being. Educating and raising awareness. Educating the public and raising awareness about NPD is key to challenging stigma and fostering a more supportive and understanding society. Through community outreach, educational initiatives, and public discourse, we can increase awareness of the complexities of NPD, debunk stereotypes, and promote empathy and acceptance for those affected by the disorder. By engaging in open and honest conversations about NPD, we can create a culture of compassion and support that encourages individuals to seek help and overcome stigma.